Ask someone for a memory of a friend, and it won't take long to reveal a legacy. This is especially true in the case of William T. Patrick Jr., known to all as Pat.
He was a man of great integrity and compassion.
A joy. I mean, he was the kind of person that you just connected with and just wanted to be around. Very strong leader in our community and in our business industry, and very caring and kind and funny, like hilarious in a mischievous way. Just really, really, really special.
I know your blood pressure was a bit high this morning. I'm gonna write.
I'm Jen, and I'm going to be your nurse today, okay?
Hi, Jen.
So I like to start out just by listening to your heart and lungs, make sure you're doing okay. Sound good?
The greatest legacies live far beyond the eloquent words of longtime admirers. At Bon Secours Memorial Regional Medical Center, Pat Patrick's impact lives on right here.
And I just wanted to come in and talk to you about your discharge plan, about where you're going to go from here.
Today, nurses throughout Memorial Regional are living examples of the legacy of Pat Patrick. A successful entrepreneur, Pat leveraged his business success into ensuring that Bon Secours and Memorial Regional would achieve great success in caring for their patients.
He served on a lot of our boards. He was particularly passionate about this hospital because this is his community that he and his family live in.
Pat placed his greatest focus on the nurses who work the front lines of healthcare 24 hours a day, 7 days a week. And so it is only fitting that a fund dedicated to supporting nurses is named in honor of him, the Pat Patrick Memorial Regional Medical Center Nursing Excellence Fund. This fund pays for the continuing education and certification of Memorial Regional nurses, strengthening their competence, confidence, and their degrees of excellence as they treat patients in our hospital.
In the healthcare industry, things change every day. So adding additional education, keeping up to speed on knowledge and new procedures and clinical avenues is extremely important.
For nurses who have been able to attend magnet conferences and pursue advanced degrees and levels of certification and excellence without having to incur the costs, the Pat Patrick Fund has been a career changer.
I'm having courageous conversations with physicians and other case managers about patients' length of stay, readmissions, patient status, and trying to get it correct for the hospital and to the benefit of the patient as well. 5 years ago, I would have been scared to have those conversations, whereas now it's my job to explain it to the best of my knowledge, to get the doctors and other case managers to a level that they can understand it, to help the patient and to help all of us.
I'm proud, confident, know that I know my job, and I can just be the next best nurse for my patients. Patients ask questions, they don't talk to the physicians. Physicians come in, they talk, they leave, and then you come in, the patient wants to know from you what's going on. And so knowing that I have the education or the knowledge, and that I'm confident because I can tell them that I'm certified, and just the fact that patients, they have more confidence in me.
People who knew Pat say he would have thought a fund named after him brought too much attention his way. He would rather focus on his wife Phyllis, their kids, and the abundance of love he had for his grandchildren. They never left his mind or his heart, even during his cancer treatment.
One of the times that he was here, it was Easter, and he loved Easter. And so we got together and put together an Easter egg hunt in the courtyard for his grandchildren, and he was well enough to go down and to be a part of that, so he was able to experience what he would normally do at his house for his grandkids, only we had it here. It was very special.
In his final days, Pat's attention also focused on the people he viewed as the most important in the medical field, the nurses.
He never, ever forgot how good the nurses were in their care of him. And when he was very sick, he asked for the nurses, for Jill to come in, and he wanted to tell her, I don't know that when I'm sick and dying, I'm going to remember anyone. That's who Pat was. He wanted to be certain that the nurses knew how wonderful they were to him.
Few legacies have been more richly deserved.